Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Anuj Sharma. He's a gastroenterologist. Today's Kevin MD article is Fatty Liver Disease is no longer reserved for older adults. Anuj, welcome to the show.
Well, thank you so much for having me on the show.
All right, so you are a gastroenterologist. Tell us a little bit about your practice.
Yeah, well, my name is Anuj Sharma. I'm a gastroenterologist. I've been practicing medicine and have been treating GI and related conditions for several years now. I've been always drawn to GI that it allows both procedural work and long-term patient care. And over time, I have seen the field evolving, especially in IBD, liver disease. And lately, what really caught my attention was changing face of MASLD, or also known as metabolic dysfunction associated steatohepatitis liver disease, previously known as LAFLD.
All right, so you wrote about that, of course, in your Kevin MD article. For those who didn't get a chance to read it, tell us what it's about.
Yeah, so the article I wrote for the Kevin MD, it stemmed from the real patient encounters. I was seeing young adults, people in their 20s, who didn't drink excessively, weren't obese, yet had early signs of fatty liver disease or MASLD. Many were shocked to learn that they have liver problem at all. So that what prompted me to look into the broader picture and start asking questions really about what changed in the environment, in our diet, in our gut health that could explain this. And that's what led me into taking a deep dive into the science of the gut liver axis, which is basically an anatomical and biochemical pathway that links our intestinal health directly to our liver.
All right, so before we get into that, just get everyone on the same page. Just give us a 30-second primer of what fatty liver disease is.
Yeah, absolutely. Fatty liver disease, that's now known as MASLD, as I said, metabolic dysfunction associated steatotic liver disease. It's a disease where you have inflammation in the liver, which can be attributed to metabolic dysfunction. Generally considered, linked with obesity, insulin insensitivity. But lately, we are seeing this in even in younger patient or healthy who otherwise normal BMI. So what happened in this condition is you have a fat accumulation in the liver, and that leads to the inflammation, and the inflammation can eventually lead to scarring, to advanced fibrosis, cirrhosis, and in some cases, liver cancer. So it's very important to catch this condition early on and then prevent it to avoid these outcomes.
Now, I'm a primary care internal medicine physician. Typically, when I see fatty liver disease, like you said, older
Mhm.
adults who drink, who are obese, typically they present with elevated transaminases that leads to an ultrasound, and then that's how fatty liver is diagnosed. In these
Yes.
younger patients, though, who, like you said, are otherwise healthy, how are you finding fatty liver in them?
Yeah, and that is the part of the challenge, right? How to figure out those people who are in 30s who exercise regularly, don't drink. So I think having a low threshold to screen for those patients is important. Anytime we see any abnormality in triglyceride, in lipid panel or insulin insensitivity or even high glucose level notice on the BMI should prompt you to look for it. And the testing that we have available are very non-invasive testing, a simple blood test, a mild elevation in ALT, or non-invasive testing such as ultrasound, which is widely available, can help us, diagnose this condition early. So I think education is part of it. Knowing that it's happening even in the patient we don't anticipate is a part of the struggle here. And the part of the education or the push here is to spread this information to out there to all the primary care physicians.
So now take us through the pathophysiology, especially in the younger patients. Why is this happening?
Yeah, so when I start seeing this in my younger patient, I researching more into it and then see what is that essentially triggering these inflammation in an otherwise healthy patient. So that the main focus or the main theme that I encountered was a diet. You
Mm,
know, and the diet was the two. It was a dual focus. We always focus about on the healthy diet, Mediterranean diet. The diet which is high in vegetables, fruit and vegetable. But I think the one aspect that we're missing was eliminating the gut damaging diet. The diet which is high in processed food,
mhm.
emulsifiers. Those are so it's a dual focus which I think needed to be done in case of a MASH. And that's what I was noticing, a common theme or a missing link in a patients who were otherwise healthy. That even though they were eating healthy diet, but also they were eating unhealthy diet at bulk, which led to the inflammation.
And when you say these highly processed foods in your patients, are we talking about just a lot of processed snacks? Are we talking about refined carbohydrates? What are some examples of an unhealthy gut damaging diet that we're talking about?
Yeah, so I think it's a bit of both. There are food which, like processed food, is pretty like a low hanging fruit, so to speak. Those are easy to identify. But things as such as emulsifiers, which are the product you use to mix stuff which you otherwise are not easily mixable, for example, oil and water. But those are also pro-inflammatory. They are commonly found in peanut butters, baking products, even in some vaccination. For example, COVID vaccination has it too. So it's widely available, but it can trigger, high inflammation. Emulsifiers such as polysorbate 80, those can trigger inflammation. And then, of course, your simple sugars, those are also readily available, which can trigger a pro-inflammatory state. So there are evidence that suggests that they increase the expression of microbial genes, which lead to the inflammatory cascade. And that shift lead to the increased gut permeability, and then which drives basically hepatic inflammation. So these stuffs are very, very easily missed if you're not looking for those,
Mm-hmm.
if you're not educated about those. So I think awareness is the key here. Just talking about it and spreading it out there, will be useful.
So, just to be clear, you mentioned these emulsifiers being found in foods like peanut butters and baking products, but you also mentioned a COVID vaccine. But is that on the same scale because you're getting a vaccine once every year versus food that you potentially can eat several times a week? Is it the same scale?
It is not the same scales, and of data is obviously, they has shown that it does not impact as compared to, for example, food which you eat regularly on daily basis. The one emulsifier is a polysorbate 80, which is the one who found in the COVID vaccination. And from what I know, there is no direct evidence linking to pro-inflammatory state and those vaccination. But the point I'm trying to make is it's widely available in the things that you, from supermarket to all the way to in the clinics where you get the vaccination. So just be having awareness of it, just reading it, just know what you're putting in your body helps and goes a long way in maintaining a good health.
So, you mentioned finding this early, especially in younger adults. So, screening, what ideas do you have for that?
Yeah, so the universal guidelines are still lacking. So I
Mm.
think it's a multifactorial when you talk about screening. I think a blood test, just checking liver function enzyme, is a good start. If there's a mild elevation in liver enzymes, it should be followed by some sort of non-invasive testing, such as ultrasound, elastography. And if there's any question or abnormalities in liver enzymes, then a prompt consultation with a local gastroenterologist or hepatologist should be made. But those are readily available pretty much everywhere, and those are the basic framework that should prompt or start the workup. And then if there's any further question, a specialist consultation is warranted.
Now, in your article, you mentioned potential of things like probiotics to prevent fatty liver. So, what's the evidence there?
Yeah, so the American Gastroenterology Association recommends the Mediterranean diet, and they do in context of the gut microbe health and the probiotics. So basically, the role of dietary fibers helps they act like as a broom, which
Hmm.
helps nurture the good bacteria. And the prebiotics help in modulating the gut microbiome, and they mitigate the gut dysbiosis in the fatty liver disease. And both the American Association Study of Liver Disease and the American Heart Association as well, you know, recommend that any food that increase good gut health should help in preventing heart disease and liver disease. So that's where the probiotics and prebiotics come. There are not that many studied except BSL number 3.
Hmm.
So most of the products that we find in supermarkets, they're not well studied. But in theory, if they contain all the prebiotics that stated on on any products, if that's truly what it is, then those do help maintain healthy gut microbiome, which in turn lead to healthy liver and healthy heart.
Now, is steatohepatitis or fatty liver, is it reversible once we find it early?
Yes, it is reversible to some degree, and there are new drugs coming up in the FDA approved too, which can be given. But it's also reversible mainly through the diet and exercise. Weight loss does remain the primary treatment. It is recommended to lose 7 to 10% current body weight if the BMI is higher. But of course, if the BMI is normal, in that case, the diet remains the primary treatment, which again is the topic here, that how we can eliminate the inflammatory diet. So there is some degree of reversibility to that.
And just to give us an idea of the time frame, if someone discovers they have fatty liver and makes your suggested changes with their diet, what kind of time frame are you looking at to notice the improvement in the fatty liver?
Yeah. So this is a very emerging field. I'm also curious to see how it evolves in 5 to 10 years. So it's very hard to put a time frame to it. But I reckon within usually in our clinical practice we repeat ultrasound or elastography every 2 to 3 years. To kind of trace the progression. So I think within 5 years, I would suggest you start noticing any evidence, at least radiologically, in ultrasound. But you can notice improvement in liver enzyme within few months. The AST and ALT going down within a few months, especially in patient who has a higher BMI. If they lose 7 to 10% within the next clinic visit, you repeat the liver enzyme, they normalize, or at least they're trending down. So there is a both immediate results and there's a long-term improvement too, both objectively proven with liver enzymes or with ultrasound or elastography. So the results can vary from months to years depending on the modality you're using to objectify those results.
Now, if I'm a younger adult, someone in their 20s or 30s listening to you now, tell us the single biggest change they should do to help prevent potential fatty liver.
The single prevention thing you can do is, stop eating processed, food which is high in sugar.
Mm-hmm.
Your body will react to what you put in. Okay. So diet rich in additives, emulsifiers, artificial sugar, not only it affects your liver, it affects other organ. More often than less, we think as a specialist, we focus on one organ, but your body is not one organ. It's just an indication of what's going around in throughout your body. Even though the liver is the one damaging, the heart is the main reason why people with fatty liver disease end up having high mortality from. So reading and be just conscious about what you're eating is going to go long way. Restricting the eating window to 8 to 12 hours per day, time restricted feeding, avoiding late night caloric intake, or coffee consumption, which is also associated with the reduced risk of hepatic steatosis and fibrosis. So those are simple things which you can do. You don't have to go taking out your wallet to buy those expensive healthy food, but these are just a lifestyle modification, just eating during daytime and just avoiding late night snacks and those kind of stuff, which will go a long way in improving your health.
We're talking to Anuj Sharma. He's a gastroenterologist. Today's Kevin MD article is Fatty Liver Disease is no longer reserved for older adults. Anuj, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Yeah. So, the key message that I want to leave mainly to my colleagues, especially the primary care, that fatty liver disease is rising in young people, and the gut may be the missing link, and this is not a benign or a distant problem. It's happening now, often silently, and it is preventable. The earlier we screen, we educate and intervene, the better chances we have to stop this condition and its progression to cirrhosis and liver disease. So we need to move beyond the weight loss and start thinking holistically about not just about the quantity but the quality of the food.
Mm-hmm.
And hopefully intervene early so it does not turn out to be something like cirrhosis, which of course we know is a disease which carries high mortality.
Anuj, thank you so much for sharing your expertise and insight, and thanks again for coming on the show.